patients. We have seen patients who are being discharged home who really still require intensive care, not because of the equipment, but because of the bodily functions that need to be supported at home. So we do have nurses who take care of such patients in their homes. So what is our recommendation? We have to embrace nursing as a noble profession so that more people within the community can advise their children to take up nursing. Because right now we have a very low number of Muslim nurses, especially in the critical care. That's why Dr. Abdullah has asked me, why do we have only 3 critical care nurses in Mombasa? We need to sponsor more nurses in the specialized training. Many can't afford to pay for the school fees. Some are very young and have not been introduced to these areas. So if we do have consultation between the younger and the older nurses, we could introduce them into these special areas, and probably if they build interest, they could be sponsored for such trainings. And then if we eradicate the gender seclusion in the nursing profession, we know that it is mainly a female profession, but there are quite a number of young men who've taken up nursing, and it assists in these specialized departments, especially in the critical care, in the perioperative. We do have a few male nurses, but if we had them specialized, it would have been better. We also encourage inter-hospital critical care nurse exchange program. We had some recently, inter-hospital training between Aga Khan Hospital, Pandya. This was to improve on the management of acute coronary syndrome. So together we got to learn and appreciate what everybody does in their centers, and with that we work together as a team irregardless of which hospital you're based in. And then also, if we empower critical care nurses to make decisions and utilize their knowledge and skills in order to improve patient care, probably the nurses' self-esteem would improve and would feel the worth of working in these centers, because they're quite stressful in terms of task and hours. We need nurses with stamina to work in these areas. As Dr. Abdullah had said, he doesn't know how many years I have worked. I'll let him know later. Thank you. Thank you.
Thank you very much for that elaborate and up to the point specific with recommendations and the challenges that are faced. And inshallah, I hope as KAMMP we will be able to include in our mentorship program, not just for doctors, but for nurses as well. We hope that the senior nurses, mashallah, we have quite a number of you, if they could mentor the younger nurses or the younger generation that is hoping to take up nursing, we will work towards that, inshallah. Thank you once again, and now we will go to the next speaker, who we call Wale Jamaa Anti-Corruption. Is Dr. Abdi Malim. He's the commissioner of the EACC, Ethics and Anti-Corruption Commission. He's a nurse by profession, and previously he has worked with Moi University Medical School. He was one of the founders of Aga Khan University, East Africa. He worked with Ummah University. He worked with WHO, and then on to Transition Authority, which was involved with the devolution process. Karibu Daktari. He's going to talk about assessment of non-pharmaceutical purchases in Kenya.
السلام عليكم. إن الحمد لله نحمده ونستعينه ونستغفره وأشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله. Let me take this opportunity to first of all thank the organizers for allowing us to come and present this short presentation, which we presented to the Minister of Health and the county governments late last year. And it is really a short presentation. The report is uploaded on our website, and it's something which we requested the Ministry of Health and the county governments to undertake by implementing some of our recommendations. Of course, you have seen what Dr. Anissa and Dr. Abdenour talked about. What is the cause of drug abuse? The cause of drug abuse is corruption. Yeah? Yeah, it's the cause of drug abuse is corruption, because it's only through a corrupt means that people will bring drugs that are outlawed, isn't it? It is just because of corrupt officers at the immigration that you let in these things come in. It's just because of corrupt officers that allow in policemen to be bribed and release that from the port. And it is just the same corrupt officers that let in Al-Shabaab and come and bomb us. So it's the cause of corruption, all these problems that we have. And Allah subhanahu wa ta'ala says, وَلَا تُفْسِدُوا فِي الْأَرْضِ بَعْدَ إِصْلَاحِهَا. Don't make chaos. Don't cause chaos after God has stabilized the world. And the Prophet sallallahu alaihi wasallam said that those who give bribes and those who take are both of them what? Cursed. And for your information, the Ministry of Health, for the last, every year we carry out a national survey. For the last 3 consecutive years, the Ministry of Health, both at the county and the national level, was second to the Ministry of Interior in corruption index, according to the Public of Kenya. Interior, you know who are there? The police, the immigration, Alawatu Akipande, all the rest. If a noble profession like health workers have become 3 consecutive years, we are not, angels anymore. I was just joking with Dr. Mirjan. I told him, as a medical, and I used to tell my students, if you cannot disclose that you are hypertensive, you will never disclose your HIV AIDS positive. Will you? Yes, it is a time now you have to speak loud about corruption. Okay, let me take, briefly, this is some of the topics, maybe the areas to cover, just highlights and recommendations. Every year, point will give some recommendations and then maybe make some conclusions. First of all, it's part of our legal right to initiate investigation or any assessment among any government institution. And in fact, we are having a lot of requests. We carry out what we call corruption risk assessment in the counties, in ministries, and now the ministries and every other institution is asking for that, and actually we are overwhelmed. For your information, I think you have had many times, even our new CEO the other time when he was on the television, that we conducted, by that time I was not even in the AAC, we conducted the assessment of corruption risk assessment in NYS 1, and we gave recommendations. It's only after NYS 2 has actually occurred, now they're implementing what we told them to include making it a parastatal agency. So we have this legal mandate to carry out what we want. Highlights, and we'll later look at some of the issues which are very important. Licensing of supplies by pharmaceuticals, non-supply, non-farms which we are aware of. We have what we have noted that actually, according to the record, that this data was collected from, as you will see later, Mombasa, Kisumu, Nairobi, Eldoret, and another place, about 5 big cities or towns. And what we saw that literally there's no supply list. People don't know who are the people who are supposed to supply non-pharmaceuticals. So anybody can bring, and you can go and sell. And this is dangerous. Assessment, licensing, and the maintenance of an accessible register of certified manufacturers and distributors of non-pharmaceuticals should actually be undertaken. Recently, there was a pharmacist who came and talked to me when I gave a speech somewhere. And he said, you know what? I am a pharmacist. I'm working in a county, and I'm telling you the drugs we are getting is not the drugs we used to have. You have capsules here. As you try to dispense, they start speeding off. Yeah? What does that tell you? Because people are not paying KAMMP, they're now going to other places. And that's governance and the environment of operating this. The Ministry of Health develops a national supply list to guide stocking, prescribing, and dispensing of medicines. This one we are aware of. But what we found that the distance or the review of these guidelines takes too long. And as the county governments came into place, not many people are aware of. The last one was, initially there was a 2010 which was reviewed, and the next one was 2016. This may deny the public sector access to more cost-effective pharmaceutical supplies. And you know, we have drug lists according to common diseases which actually can help any county or any. So this is really a problem, and we have found, so we say there's a need for periodic review and distribution of essential supplies list to all procurement entities. This will also, sometimes I remember when I was with the devolution, KAMMP were actually they are no longer in existence. And if they're in existence, nobody used them. And this is really a big challenge. Their role is very clear, as you can see on the board. The list goes on, but what is the challenge? What we are saying here is there's a need to have enforcement of establishment of the MTCs at the county level and institute periodic monitoring of their functions and involvement of decision-making process when they are getting these drugs. If we don't do, we end up getting drugs from the same way we have sugar with mercury. Don't be surprised. And recently, it was really said loudly that sort of drugs that we are buying, we have to be very careful because there are people who are purchasing, counties maybe they are supplied if they are not going. KAMMP is not because it is government entity, but KAMMP is a well-regulated. It takes security. It has got the cheapest also. It can deliver for you at the point wherever you want. It is well tested. It's regulated. But when you buy from somebody else, because you know this is the normal thing. You have a credit. You have taken loan from this person. Now you are avoiding, and you go and take from other time. And that's what actually some of the counties are trying to avoid, and other entities. And I think KAMMP really has to work on this. Next is about acquisition process. And this is also very, very important. And these are the counties that we went through: Mombasa, Kisumu, Nairobi, Bungoma, Eldoret. These are the areas. And there's really this drug list which really need to be done so that these people can buy drugs at a level that they can able to within the market was not there. What we are recommending, Minister of Health, there's a need for liaison with the Minister of Health to obtain latest approved list of essential medicines and medical supplies. I think this is even in line with WHO guidelines, and this will really help the counties have the relevant drugs and also at a cheaper price. Okay, now that is another one, guidelines for the same, and its recommendations develop and operationalize appropriate guidelines for handling urgent requirements to ensure quality assurance and control pricing. You remember in corruption, where corruption actually thrives most is during creation of what you call emergencies. Yeah? I'm a trained emergency health response of the WHO. Before I joined, actually I was in Eritrea. When there's an emergency, if there's an outbreak of cholera, and I was telling when I was coming, 2009 I was health advisor for Danida here for Coast. And we used to have a lot of cholera from Congo and whatever. And I remember one time we went and found what was the reason for this sewage problem, only to find that where the main sewage tank was, there's a 7-story building. Yeah? I can remember. Now, when emergencies come, everybody will run here and there and buy drugs, isn't it? And that's where the problem is. That is where the problem is, because the prices will be inflated. There will be nobody who's going to follow procedure. But in law, even if you will have, we cannot miss emergencies. I had the opportunity at that time when I was with WHO with Dr. Omar, who was here at that time. We controlled the Rift Valley fever, 207. The amount of resources that were pouring from everywhere was really huge. So here, when emergencies come, everybody buys and say, you require an emergency, and that's why some of us, for many years, we have never seen development from Lamu, Tanariva, Garissa, because we were in the emergency. Nobody was accounting for our money during the emergency rule, isn't it, for 30 years. So that's why now we are saying give us equalization money, because our money was being utilized for emergency and nobody was accounting. So here, there is a need, even if you are going to run an emergency facility, there must be a system put in in place, including people who are already shortlisted as providers in case of emergency. Okay. Then, of course, there's also the other issue of pricing, which is very, very important. And you know, I think it was mentioned, the Pharmacy and Dentist Board was mentioned here. Sometimes the people who provide this, Minister of Health gives minimum requirements for tenderers who have got the capacity and the ability to provide some of these drugs. But it is not really done that. And we are calling for the Pharmacy and Poisons Board plus the Public Procurement Medical Authority, Disposal Authority really to take, so that these people are aware. What are we recommending lies in between National Treasury, the Public Procurement and Regulatory Authority, and the Minister of Health to develop a standard tendering document that requires the pharmaceutical and non-pharmaceutical supplies actually meet the minimum requirements. I was just asking Dr. Bajeber, although it is good to use, but I was saying, is Kenya under the obligation to use the FDA for your drug, whatever? I'm not sure whether we are being regulated by FDA, but the point is, whenever something is coming, we must liaise with the relevant authorities. When you're purchasing drugs, there must be people who have got such a minimum. That's why you can see money going everywhere in billions. These days, we are not counting millions. Millions imekuwa sasa penny billion ya pesa nane zamani tulikuwa tunasema. So there's need really to have the guidelines. And all those of you who work in the counties and even those who are actually, what do you call, accounting officers, please, if you have any problem, call us. Or call the Kenya the procurement, Public Procurement and the Regulatory Authority, all the other agencies. And that is really going to help you a lot. Then, of course, this is similar. Some procurement entities did not have laboratories, yeah, to test. And I think we have mentioned this. And exactly this is what actually the officer told me, the breakage of drugs, which was substandard systems. Recommendation, consider establishment of regional laboratories to ensure quality. And I'm happy there was a guy's pharmaceutical, what we call a friend here, Abdi, who was giving us very good from Metropolis. We really need such institutions so that they can give us safe drugs. Okay, the same also, here is where I want you to pay a little bit of attention. At the time when we were going around, there was a lot of concerns. And people, the counties have not paid about, nearly look at that, 897 million shillings to KEMSA plus. And one single county had an outstanding bill of 18, that's almost 19, isn't it? Million shillings. This is why the counties are not buying from KEMSA and taking us to areas where we don't have, because they are not submitting, paying KEMSA. Why? You go there, you also hear statutory reductions for NHIF loans are not also happening. This is against the law, as you are aware. And this is where we have found, and it's dangerous. And we are saying develop and implement, okay, a creditor's payment policy aimed at settling debts within the specified period. Because once you will go for something else, yeah? You will go for another entity, and that is not good for us. Okay. The third one is the dispensing process, and this is also very important. The team noted variance in prices of drugs and the medical procedures, in drugs and medical procedures. And just let me read that, what we call recommendation, develop guidelines for determining fees for dispensing and supplies and charges related to various procedures at health facilities and counties. This is why I was saying I wish the NHIF guys were here. Look at those figures, yeah? Yeah? Can you see those figures? Adrenaline 1 gram, seven, you can buy that from KEMSA at 7 shillings. Someone is selling 18, another one 30, another 100 shillings. What is the reason? KEMSA delivers drugs to whatever point that you want. Okay? The other one, let me see. There's one which is very, very unusual. Look at anti-rabies. Yeah, you buy 966. Somebody selling at 1350, but another one is so good and it's selling at 200 shillings. Yeah? Now look at the last one, pyloric kit. You buy from KAMMP, 840, you sell at 1,300. Another one is selling 2,400. These are the same Kenyans. Yeah? This is a government hospital. Why? Somebody is saving money from somewhere, isn't it? Yeah? And we are talking about universal health care, health access or health coverage. Yeah? How can you have a difference of 840 to 24? So it's really a challenge. Let's go to another one. This is one which concerns many of us here. Look at those procedures. Can you see? Acha nikuja hapa. Yeah? Okay, that's why I was saying I wanted NHIF guys here. Is Dr. Mrijan with me? Neck, look at that. That is that. Now look at this removal of stitches. Okay, this one, that. Look at this and this. Removal of nasal pack from 700. Another one. Where are we? Do you know why? When it is cash, you pay this. When it is NHIF, you pay this. This is haram in Islam. It's haram. It's haram in Islam. Because the Sheikh said that NHIF is halal because that's Baitul Mal. Now you are stealing from Baitul Mal. What is your judgment? Yeah? Syrian section? Okay? 20,000? Cash. 90,000? NHIF. What changed? Brothers and sisters, this is not Islam. And the Prophet ﷺ said there is somebody who will stand there. He looks tired, dusty, shaggy, raising his hands. He says, please help me. But what he was brought up was haram. What he has eaten is haram. What he is wearing is haram. فَأَنَّا يَسْتَجِيبُ اللَّهُ. What does that mean? If we bring our children with ill-gotten money, that's it. Are you there with me? Why are we doing this to Baitul Mal, if that's Baitul Mal? I'm not saying we are the ones who are here, but please, those of us who are there, don't do it. The Prophet ﷺ one time was walking somewhere, and he found somebody selling wheat flour. Oh. And as he was going, the hadith said the Prophet was given inspiration. And he just put his hand in the flour. And then when he put him, he lifted it, so found under the flour was wet. And he asked the guy, why the difference? He said, it was rained on. And the Prophet said, why didn't you bring the wet part upwards so that people can see it? So brothers and sisters, this is not good for us. For Muslims, we are not supposed to feed. I was recently given by a sheikh a story. He said there was a man, somebody who benefited a system like this, and he became very huge multi-millionaire. And in his death time, he said, I can see my days are almost there. I only beg you, the shroud that you're going to give me, kafan, don't use my wealth, because the start was not good. Can you imagine? He is asking for someone else to help get kafan. And he's a multi-millionaire, that person, at his deathbed. We throw to Makkah for Umrah, for Hajj, nothing. It doesn't help. It doesn't help. Okay? What's next thing? In conclusion, I think the report is more detailed and you can find it on our website. And the purpose really is for us to improve the systems. Some of the recommendations will have to be taken up by the ministry, others by the county level, and others individually ourselves. We are the ones to show. When Allah subhanahu wa ta'ala says, وَلَا تُفْسِدُوا فِي الْأَرْضِ بَعْدَ إِصْلَاحِهَا, everything is justified. اعْدِلُوا هُوَ أَقْرَبُ لِلتَّقْوَى. Do justice in everything. Among your children, among your wives, on people who are doing business. Because that is where piety is. Thank you so much.
Thank you very much, Dr. Abdi, for that presentation. It's good to know that we have people like you to guide us on these matters. And this calls for more importance of attending these conferences and gatherings of Muslim healthcare professionals. You never know who is who or who can assist us in which department. So once again, Jazakallah khair. We'll take a few questions. We're not done for the day completely. We are done with the talks. Now we need to discuss way forward on our AGM. So a few questions, and then our important speaker from Turkey has a gift that he wants to present to our chairman, or he said he wants to be called the president as well right now. And then after that, we'll have a group photo, please, because our guest wants to leave and he wants a photo with us, please. So a few questions, please. These are very important topics we had today. I know you're tired, but if there's anything you can, yes.
Assalamu alaikum. Now, this question goes to Dr. The one Farouk. We operate in pharmacies. Do we sell syringes and needles to those who use ungas and heroin, for those who inject themselves with the drugs? Because, like I experience most of the time, they come to my pharmacy, they want to buy syringes and needles. So should we sell to them, or just tell them to go away and get advice from your centers or your reach out centers, all these things?
Should I answer that question, or should Dr. Anissa answer? Okay, the question is, if he's working in a pharmacy, then a drug addict comes demanding that he should be given a syringe and needle, right? Or should we refer him to mayor or reach out? Okay, that is a very good question. The idea behind needle and syringe So, if he comes to you and demanding that he need a syringe from you, it means that he is going to use it. And if he's not going to get from you a clean one, he will go and get it from his friend who is HIV positive. And the risk of him getting being infected with HIV is high. So it will be better you give him a syringe. Okay. Yeah, sell him, please. Sell it to him.
Okay, thank you for the answer.
The reach out in Mayo actually supported by the Global Fund. So for them, the syringes and needles are free. But if they come to a pharmacist, they should be able to pay. And by the way, don't assume all people who use drugs are from the lower socioeconomic status. You know, that's a false assumption which even I used to have. There are some very, very rich, wealthy people who actually use drugs. And we've heard of people who've just dropped suddenly. And then when we hear people whisper behind, hey, unajua, he died of an overdose. You know, we've heard of these things. So sell it to him or her.
And you know, that why are we giving them needle and syringes? We are just promoting the use of drugs. Okay, there's another alternative. Why can't we put all of them in Shimolatewa and where prison? We should take them, put all of them in prison. It will be a win-win situation. Mind you, we did a study. We have 18,227